Yes,
There we
there
are.
you are. Hello, welcome.
Hello. Hello, hello.
Sorry
Pronouns
we're a
are.
bit late,
That's
but it's
okay.
been all such interesting stuff today. And
Absolutely
welcome
fine.
to you, the Malnutrition Strategic Lead from Wales, I'm going to say, because I definitely can't pronounce what I've got written here.
That's all right. I'll forgive you, Leslie.
And you're going to talk about raising the awareness of deconditioning, because, you know, that is such an important issue, isn't it? And we need to understand it fully, because I don't think sometimes we do, and especially how malnutrition is connected to that. So thank you for this, and off you go.
Lovely. Pleasure. Thank you, Leslie, and thank you, Kate, for the invite. And I think the stars aligned this week, because what we're going to share is a video clip that has been created in Wales, and the filming was done around May time to raise awareness, but the stars aligned, and last week it hit Health Education and Inspectorate Wales, HEIW's YouTube channel. So I shared with Kate, who you heard from earlier, and she said, oh, it would be great to try and share that now this week, to try and align some of how we're coming at things from a policy position as well in Wales. So my post is based within Hywel Dda University Health Board, and I'm leading on malnutrition strategy across the health board. So looking at joining up some of the thinking as a whole system approach to tackling malnutrition with our acute community and third sector partners, and really acknowledging the fact that we need to start moving away from the siloed thinking, siloed working, siloed budgeting, and looking at a real whole system approach to have the most impact. And Wales, under the guidance of, she is now Professor Sally Lewis, has been very, very keen on supporting a whole system approach to tackling and treating health and social systems in Wales. So again, in 2021, when I was relatively newly in post, the 6 Goals for Urgent and Emergency Care policy was published by the Welsh Government, which was designed to set out the expectation for health and social care partners within, and independent and third sector partners within Wales, for the delivery of the right place, right treatment, first time for physical and mental health. And it aims to do this by looking at the clinical outcomes, the value experience for patients and the staff. So it's really taking a proper value-based healthcare approach. Now, of those 6 goals, they're very much looking at home first solutions. You know, the conversations I've heard now today are, you know, exactly these conversations, that real proper preventative arm. But goal 5 focuses on, once patients are actually within a healthcare setting, within an acute setting, it's making sure that you provide that optimal hospital care and discharge planning from the get-go, so that you're centering a preventative prevention around deconditioning developing. And obviously the focus that malnutrition has to play here is key. You know, yes, that it's an MDT approach. You have the OTs, physios, clinicians, nursing staff, but, you know, without providing that fuel, providing that hydration, you know, taking that whole system approach and whole person approach is absolutely key. And one of the things in Wales is there's a feeling that there's often this cwtch culture, that we sort of protect people, want to keep them in bed. So it's trying to really sort of educate and get people up and going. And this video is pitched to support and encourage staff of how can we as individuals support getting people up and out of their beds, supporting that deconditioning within prevention, within the acute setting. And strong clinical leadership from Dr. Siobhan Lewis, who you'll see is one of the programme leads. And it's how we're thinking about weaving malnutrition into this, and how other professions are supporting this. So Sophie, I think, is going to share the video recording for me
now. Yep. Flag
Brilliant.
if there's any issues.
Lovely, thank you. So it's an 8-minute clip. Like I say, lots of professionals just you know, sharing how we're going to tackle educating professionals particularly. So thank you, Sophie.
Here at Health Education Improvement Wales, we work closely with the 6 Goals programme to help raise awareness of the impact deconditioning can have on patients and their families. It's really important that we continue to educate our NHS Wales workforce to recognise the signs of deconditioning so that they can take measures to prevent it from happening in health and care settings.
Avoiding deconditioning is everybody's business.
The people that come into work for the NHS care, they care for people, they want to look after them, and you know, if you've had kids or family members, if someone's ill, you know, I'll put you into bed now and you know, we'll look after you, we'll run around and get you all these things. It comes from a place of love and care. We're now more educated to understand that actually on a lot of those occasions we're doing harm.
So deconditioning is a range of things. People probably understand it as something that happens to older people when they come into hospital and don't move around as much. But actually people who come into hospital spend up to 83% of their time in bed and 12% of their time in a chair. And during this time, muscles can become really weak. And this can happen at any age, and it can happen to anyone, not just in hospital, but at home when we're feeling unwell or we're not as active. And it's happening across the whole world.
And there's a misconception there for some patients where they feel that going into hospital is that safe space. And it is when you're unwell, but when you're not unwell and you're back to your normal sort of level of health, hospital is not a good place to be. There's lots of infections to pick up. There's this risk of not doing as much as you would do in your normal life, so that deconditioning kicking in.
Reduced mobility, incontinence, psychological issues, low mood, loss of appetite.
The link between deconditioning and malnutrition is a very, very close one, and we know that patients that are at risk of deconditioning are often malnourished, and it's that frailty, deconditioning, malnourished pathway that all interweaves itself that we can actually do something really positive to try and stop happening, because malnutrition is a preventable condition, just like deconditioning is a preventable condition as well.
The less active someone is, the more likely they are to fall, because they're losing that strength, that balance that they need and they develop when you move and do normal activity.
So many of our patients that do come into hospital also have a mental health cognitive impairment. So somebody might come in with a mild dementia, but hospital environments can exacerbate that. They can become disorientated, it's not their normal environment, there's no windows to know if it's light or day.
But there are things we can do to change this, and in Wales we want to be pioneers in developing an avoiding deconditioning programme so that people don't suffer these effects as much as they do now. So I work with the 6 Goals team looking at what we call optimum hospital flow and home first. So that's trying to get people as quickly and as smoothly through urgent and emergency care and back out again the other side so they can get back home to their own homes or into the community to continue to living their lives as independently as possible. We know that when people come into hospital, for lots of reasons, people end up staying quite a long time. So the 6 Goals team is around reducing that time people spend in hospital and increasing the time that they can then spend at home. And part of that is the deconditioning work, because we know that people may come into hospital with one medical problem but end up staying longer because of other issues such as deconditioning.
Everybody knows what the NHS is like, so we all know about the pressures, the ambulances that are outside, the people in the community that can't get the ambulance, the ED pressures. And this will have a small part to play in unlocking some of that for everybody.
A lot of deconditioning work is about having conversations. It's about raising awareness, discussing those issues. And that can be done with any number of professionals, whether it's a doctor, a pharmacist, a therapist, a line manager.
So when somebody comes into hospital, deconditioning can start as soon as they come through the front door. So what our role is trying to promote independence by getting people washed as they do normally by the sink, get dressed, put their normal day clothes on, footwear, all these things can prevent deconditioning.
That's why it's really important to ask questions of patients about what they were like before, and other things such as, are they in pain that might prevent them from moving? If people have had all their x-rays and tests that tell us whether there's anything serious that prevents them from getting out of bed or getting out of the trolley, then that's the first step where we should be starting to do so. Sometimes we can use things like bedpans or catheters or bottles because we feel like it's kind to patients so that they can rest in bed. But actually these are quite hard to use for our older patients, and often walking to the toilet is the only bit of movement some people might do in that first few hours of hospital.
So for example, if somebody needs help getting washed and dressed, there is a huge range of activities within that one aspect of self-care that somebody could maintain independence. They might need help washing their back, washing their feet because they can't reach it, and that might be a risk. There may be a clinical risk there for somebody leaning forwards to be able to wash their feet because of a, I don't know, a blood pressure issue, for example. But that doesn't mean they can't put their clothes on or brush their teeth, brush their hair.
If they can't walk that far, maybe get wheeled one way and walk one way. It's really important maybe just to move their table and chairs to the end of the bed, and if the patient opposite did that, they can have a conversation over their dinner and they're kind of going away from their bed environment as well.
What we need to do is make malnutrition matter, and it's everybody's business, from the ward staff that are there day to day, the dietitians that get involved, all of the allied health professionals, the physios, OT. You've then got the catering staff, the porters. Everybody's business is treating malnutrition. So it may be something as simple as, where appropriate, start every conversation with a drink, so that you're preventing malnutrition and dehydration in our patients when they're an inpatient. It could be encouraging extra snacks, helping people with meals, helping people mobilise so that they can walk to lunch clubs, breakfast clubs on the wards where appropriate. There's having an eyes on malnutrition on a ward will help and support that real proper basic building block of preventing decondition escalating, and by preventing that you'll prevent malnutrition. The two go hand in hand together.
So a lot of people are in hospital, they're actually clinically optimised, they don't need to be in hospital any longer, but they might be maybe waiting for a third sector, a new residential home, a new nursing home, maybe waiting a package of care. But these people are well, and we need to remain them well to stop picking up infections. So it's really important to keep people's minds active in hospital. So many wards might have a book trolley that you can take around, or the libraries might have lots of access to resources, access to iPads, radios, just to take that time away, maybe puzzles, Sudokus.
So as part of the 6 goals work, we're promoting the use of daily ward rounds on every ward and every area in hospitals to try and speed up the flow of patients. It's really important that, alongside some of the other things that are discussed, that deconditioning is approached on these ward rounds as well, and that every patient has a plan around avoiding deconditioning and promoting mobility, because we know this will help people get home faster.
Everybody can play a part in this. It's not a clinical matter for me, it's a basic human caring matter, and that we need to be able to support people to have the shortest time they can in hospital, because everybody's got a bed of their own at home, and surely everybody wants to be back in that home bed.
Nobody is ever left without support. We're all under a healthcare provider, even if it's within our own home, and therefore it's just passing the baton principles of handing over the services back to community colleagues, rather than keeping people in hospital when the treatment that they've come in for is finalised.
So by avoiding this deconditioning in the first place, and by recognising what we can do in those first few hours after somebody arrives, people should be spending less time in hospital. And that has a secondary effect. That means we can improve flow through our hospitals and reduce some of the congestion and overcrowding that we're seeing at the front door of the hospital and in ambulances.
Okay then, well, thank you, Emma.
That's right.
So with that brings us to the end of the day today. And I'd just like to thank everybody for sharing your practice and the things you're proud of and the things that you're doing to raise the awareness of malnutrition. This is such an important week. So all the presentations will be on the website as soon as we can, and I'll send out a quick email to all our stakeholders, and we'll put it on social media to tell everybody when it's all ready and it's all on the website. So that's goodbye from me now, and I hope to see you next year for Malnutrition Awareness Week 25 and the 8th year. So thank you very much for all your support over the year. Bye-bye.